Helping Virginia's coastal localities improve resilience to flooding and other coastal storm hazards while remaining economically and socially viable. This is the goal of the Resilience Adaptation Feasibility Tool, or the RAFT. But the RAFT focuses on helping coastal communities build coastal resilience in an equitable way by focusing on resilience through the context of social equity. Hello, my name is Dr. Wee Youssef, and I am a professor of public service at Old Dominion University and assistant director of ODU's Institute for Coastal Adaptation and Resilience. I'm representing the RAFT team to give you this short introduction to the RAFT and how the RAFT incorporates equitable resilience. The RAFT is a collaborative process developed to help Virginia's coastal localities improve resilience to flooding and other coastal storm hazards while remaining economically and socially viable. The RAFT was developed by an academic interdisciplinary collaborative, including the Institute for Engagement and Negotiation at the University of Virginia, the Virginia Coastal Policy Center at William and Mary Law School, and the Old Dominion University Virginia Sea Grant Climate Adaptation and Resilience Program. As sea levels rise, the need to increase coastal resilience is fraught with conflict and hidden minefields of beliefs, equity, and power. For example, recurring undermines property values, impacts low-income populations disproportionately, and also threatens economic stability. As we embarked on the RAFT, we found ourselves asking, what strategies can facilitate timely action at the locality level to ensure that all voices are heard, to prevent perpetration of systemic environmental injustices, and to increase equitable resilience? Specifically, how can localities build coastal resilience with a social equity lens? The RAFT process was designed to raise these questions and support localities in creating paths to build social equity in coastal resilience. This video provides an overview of the RAFT and its three-part process for working with coastal communities and how social equity is integrated through the RAFT scorecard, the development of a resilient action checklist, and the one-year implementation phase. I will share with you the challenges and lessons learned relating to equity and justice in coastal resilience. The RAFT process has three parts, and social equity is integrated into all three parts of the RAFT process. The first component of the RAFT process involves assessment of the locality's resilience via the RAFT scorecard. Social equity is incorporated through the 5 categories of the scorecard. From assessment, localities move on to developing their resilience action checklists, and the community workshop process to develop this checklist emphasizes vulnerable populations as one focus of action. The final component of the RAFT process is the implementation phase, where the RAFT team provides localities with ongoing assistance to support implementation of the checklist action items. A key part of this implementation phase is connecting the dots for services and programs that work with vulnerable populations. How did we go about incorporating equitable resilience into the RAFT process? The development of the RAFT benefited from participation of 3 pilot localities that were selected to reflect urban communities, suburban communities, and rural communities. In development of the RAFT scorecard, we conducted focus groups with community stakeholders to better understand where and how social equity fit within scorecard components. Following the pilot phase, we successfully engaged 7 physically vulnerable communities on the Eastern Shore of Virginia. Throughout engagement with these Eastern Shore communities, we incorporated practices to embed equity within the discussions about resilience. The resulting projects have increased the community's awareness of the need to identify and prepare their socially vulnerable populations for coastal hazards, and have supported their efforts to find ways to do this effectively. Some examples include mapping critical infrastructure that serves vulnerable populations and creating emergency information magnets to be disseminated within communities. We applied lessons from this experience to the extent possible given the COVID-19 pandemic in working with 8 communities in the Northern Neck region of Virginia. For example, we identified the need to include social services agencies at the outset and brought social services representatives into the process from the beginning. We hosted 2 workshops, one with social services representatives and one with emergency managers, early in the engagement process to make sure we incorporated their specific concerns regarding vulnerable populations, risk assessment, communication challenges, and other issues. There are 5 categories embedded within the RAFT scorecard: policy, leadership, and collaboration, risk assessment and emergency management, infrastructure resilience, planning for resilience, and community engagement, health, and well-being. Social equity is explicitly included as an element of the community engagement, health, and well-being category of the scorecard. But you also see how other aspects with relevance to equity, such as vulnerable populations, health, and community engagement, are also included in the scorecard. As we developed the scorecard and engaged with the RAFT pilot communities, we recognized that we need to consider the language and terminology used and how we frame coastal resilience. Recognizing that the environmental justice terminology may not be appropriate for or resonate with rural communities, we used the term social equity instead of environmental justice. We also learned that because low resource rural communities may not see coastal hazards as a primary concern, we needed to broaden the conversation and frame coastal hazards within the larger context of community resilience. From a process perspective, a key lesson we learned was the need for broad and durable community involvement. First, consistent and durable involvement is necessary for successful implementation of resilience projects, but our early experiences highlighted how various other locality needs limit the time and resources committed to and by members of the implementation team. As a result, we recognize the need to broaden membership of the implementation team beyond local government staff. We understood the need for representation of broad interests across the community. Our early work in the pilot communities also identified that local governments may constrain community involvement. Furthermore, agency staff, such as those in social services functions, may reflect the interests and needs of specific vulnerable groups, but they are often not representative of the wider range of vulnerable populations. In our engagement with subsequent localities, we intentionally broadened the invitation list for participation in the RAFT community workshops to get more community interests represented. In that same spirit of broad community involvement, we broadened the implementation teams by seeking out community volunteers with interest in specific resilience projects. We recognize that local governments have minimal or non-existent staff, and with a broader implementation team, some members are able to pursue specific projects. Working with our pilot communities helped identify the need to be more strategic by emphasizing actions to improve resilience. We learned that including easy wins in implementation may not always reflect success in achieving long-term strategic priorities. As such, we shifted the prioritization criteria used in developing the Resilience Action Checklist to include a mix of short-term, medium-term, and long-term strategic impacts. Similarly, we shifted our prioritization criteria away from doable in 1 year to being able to initiate in 1 year. Finally, our early work with RAFT communities highlighted that most communities have broader concerns of social and economic resilience, such as social and health concerns related to physical and mental health, access to care, and economic issues related to lack of jobs and lack of financial resources to cope with disruptive events. This experience also highlighted additional needs of vulnerable populations when it comes to resilience to coastal hazards. Various service agencies provide resources and support for issues such as opioid addiction, aging, pregnancy, and lack of transportation, but there is less emphasis on helping these vulnerable populations prepare for and respond to coastal hazards. Addressing coastal resilience in a way that is equitable calls for connecting the dots. Connecting coastal resilience to economic and social resilience is a significant step. Furthermore, coastal resilience requires recognition of how the needs of vulnerable populations can be met. Connecting the dots is also necessary to incorporate vulnerable populations into coastal resilience considerations. Service agencies deal with a variety of social and economic issues, but are not always empowered to or able to efforts to help vulnerable populations to prepare for and respond to coastal hazards. Connecting the dots by bringing these service agencies into the Coastal Resilience Network is an important step forward. In summary, what are the key lessons we have learned for equitable resilience from the work of the RAFT in coastal Virginia communities? First, the RAFT team brings academic objectivity to the resilience assessment, prioritization of resilience actions, and the implementation of resilience projects. This objectivity reduces perceived political influence in the resilience planning process and allows for more authentic consideration of equity in discussion and action around resilience. Second, when addressing issues relating to environmental justice and social equity, terminology is extremely important. While the term environmental justice may be useful and catalytic in some communities, others may not find it relevant and may prefer to discuss social equity instead. What terms to use and how they are used must resonate with the communities. Also, discussion of resilience to coastal hazards may not be seen as possible when economic and social resilience are more urgent and long-term priorities. It is important to connect the dots between resilience to coastal hazards and economic and social resilience, and to frame coastal hazard resilience in the context of broader community resilience that must include addressing the needs of vulnerable populations. Our team also knows that there is still much to do for equitable resilience. For example, in working with RAFT communities in the Northern Neck, we have recognized the need to identify vulnerable populations subject to coastal hazards. Other needs that have been identified by RAFT communities include having written policy on roles of different individuals and groups in coastal resilience, such as residents, businesses, schools and educators, nonprofits, faith-based communities, and other stakeholders. Effective community engagement and public communication about resilience also requires identifying trusted messengers for communicating with vulnerable populations. Similarly, plans are needed for efficiently providing water, food, medicine, and healthcare to vulnerable populations during emergencies and coastal storm hazards. Our work is not done. Thanks to a COVID-19 rapid response grant from the University of Virginia's Environmental Resilience Institute, one of our RAFT team members has been working in the Northern Neck to better understand vulnerable populations and their needs. Through this research, we have identified several categories of especially vulnerable populations, including the elderly population due to isolation and lack of transportation, school-aged children who lack internet and socialization, migrant farm workers who have mistrust in social service authorities, those without access to the internet, homeless populations, low-income families, and uninsured populations. More importantly, this research identified barriers to accessing critical services, which will be important for our efforts to better meet the needs of vulnerable populations and increase their resilience not just to coastal hazards, but also more broadly. That concludes this video about the Resilience Adaptation Feasibility Tool, or the RAFT, and how it builds coastal resilience in the context of social equity. I'm Wee Youssef. Please feel free to send emails or questions about the RAFT to myself or to any other RAFT team member. Thank you.